That's me.
So hungry. Me too. What you thinking about eating today? I don't know. Raven, are you okay? You okay? Yeah, I just all those years of smoking. I need some medicine. I actually heard about this discus that they have. That might actually help you. Really? What's the name of it? I don't remember what the name of it was.
If you have asthma or COPD and need relief from symptoms, Advair Discus Inhaler may be an option for you. Good evening. This is going to be your Advair Discus Inhaler that you're going to be using. Just to go through the parts for the Discus Inhaler, right here is going to be what you call the outer case, and located right here is going to be the thumb grip. When you slide it all the way here to open up the inhaler itself, this is going to be the mouthpiece. Now, involved with the mouthpiece, you're going to make sure that you wrap your mouth around it and have a good seal before inhaling the medication. Turning the discus this way is going to be the lever. This is where you move all the way over to the side to load the dose inside the mouthpiece. And then right here will be the counter. And what this is going to actually show how many doses you have left in the inhaler. And when you first open it up, it should be reading 60. If you look right here, this is going to be, it says the pouch opened. So what you're going to do is when you first open up the pouch from the foil pack, you're going to write down the date here. And it's very important that you do so because after 30 days, you're going to have to do the use by date. So when you open it 30 days out, you'll make sure you write the use by date because after 30 days, the inhaler will be no longer useful. Next, what you'll be looking for is the counter here. Like I said, it's going to start off at 60 when you first open it up. Now, when it gets close to using all the doses inside the inhaler, it's going to turn red at 5. When that happens, you want to make sure that you contact your pharmacy for a refill. Now, once you do actually get the refill for the newest inhaler, make sure that you store it in the foil pack unopened in a dry area. Now, make sure, like I said, you don't open it up because once you do open it, you have 30 days from the date that you open it to use the inhaler. Next, we'll transition over here to showing you how to use the inhaler step by step from the full package.
They were just getting ready to tell me how it works. Dang, my bad. Oh, I think I'm having another one.
Okay, so when you do get your prescription, it will come in a foil pack like so. And what you can do is take the Advair out of the foil pack, and then you can also take the package insert out, just in case you need help with any directions. And then when you take the foil pack, you can just throw it away. So when you're ready to take your medication, what you'll do is take the thumb grip back as prescribed, as told to before, and then you'll take the lever and you'll pull it back so that the medication is loaded. So when you are ready to take it, make sure that you hold the inhaler horizontal. Do not flip it over and tilt it because the medication can fall out. So when you're ready, what you'll do is hold the Advair to the side. You'll exhale for as long as you can. And then you'll wrap your mouth around the mouthpiece as tight as you can. And then you're gonna inhale the medication and try to hold it for at least 10 seconds. But if you can't, just do it for as long as you can. So when you are ready for your next dose, all you'll have to do to clean it is just get a damp rag and you could just wipe around the mouthpiece. Do not put the inhaler under running water because it can mess with the doses that are inside. So then when you are done with the inhaler and all the doses are gone and your counter says 0, you can throw away the inhaler in the garbage, but make sure that you disface all of the information from the inhaler, like your name, your address, just so no one gets your personal inhaler. So what we're going to do next is go into the side effects of this medication.
Raven, they were just getting ready to give me some more information I needed to know. Look, you gonna stop yelling at me. I'm about to have another vision.
This medication should be taken twice a day, 12 hours apart. Do not take an extra dose, but you can inhale the same dose twice. If you miss a dose, it's important that you should take it as soon as you remember, or if it's close to your next scheduled dose, just skip that dose altogether. Some common side effects that may occur with this medication include thrush, and with thrush you're going to see some white patches on your tongue, but to decrease the chances of getting thrush, you can just wash your mouth out with water after taking your medication, or you can you can use your medication before brushing your teeth in the morning or at bedtime. You may also experience some side effects such as throat irritation, cough, or you may have some hoarseness or voice changes, but that's okay because those are only minor. Those are only minor. Some more severe side effects that you can experience with this medication is exacerbation of symptoms such as bronchospasms, and bronchospasms presents as wheezing or difficulty breathing. If that happens, you should just contact your doctor or seek medical attention as soon as possible. And it's very important to remember that this is a maintenance inhaler. It is not for acute attacks. So if you have an acute attack, you need to call 911 or you need to use your rescue inhaler. But this is only for maintenance purposes.
Finally, I have a new medication. I'm so glad you told me about this.
You're welcome. That's what friends are for.
Let's go. You could gaze into the future.